Kentucky Spin Healthcare Transitions for Youth, Parents, and Caregivers. Is anyone familiar with the Marvel movies, specifically the character Hawkeye? Well, I'm a big Marvel fan, and when I would watch these movies, there was one character that always amused me Hawkeye. He was just this random guy that ran around shooting arrows at villains or buildings or whatever. Each arrow was different. Some could explode, some had chains, some were just arrows. But the thing is, whenever he would reach back and grab an arrow, the perfect arrow was always there. We never see him restocking, he never really ran out. He just had this unblinding faith that the arrow would be there. Transition skills are like those arrows. We need to have a bunch of them all tucked away, and we need to be able to pull the right skill out when it's necessary. And we need to have the confidence in ourselves to know that it's there. Today, we'll be giving you information on transitioning healthcare, your first arrow on the path to independence. Let's start with some background on housekeeping issues before we begin the presentation. So what is Kentucky Spin? Well, we were founded by the U.S. Department of Education under IDEA in 1988. Kentucky Spin is a statewide nonprofit that links families and individuals to resources. And what we do is we provide support and training and information for children and youth with all types of disabilities from birth to 26 years old and beyond, and as well as to their parents, families, and professionals. So a brief overview of what we intend to uncover today. Transitioning healthcare is a highly specific and individual journey. This presentation is designed to give general practices to ease the transition. So we'll be going over things like why plan and who plans, timelines, emergency management, resources, and references. So some vocabulary to go over. So transitioning youth is referred to as a transition age population, which is considered to be the ages 14 through 26. Healthcare transition, or HCT, is the program or process designed to help youth transition from pediatric medicine to adults. Medical summary is a brief document containing personal and family medical history. The personal summary is a one-page document that includes important info regarding specific issues such as environment, behaviors, etc. First, let's talk about why we need the plan. In Kentucky, a person is legally responsible for their own health care at the age of 18. This means that parents and caregivers need to begin the process of transitioning healthcare skills several years before the age of 18. In some cases, guardianship or conservatorships may be in place, but even in these scenarios, the greater the knowledge, the better the healthcare for all individuals. There are a lot of reasons why it's important to start planning the healthcare transition around the age of 14. First being that it's a complicated and multifaceted area of transition. It's insurance and insurance coverage changes, provider changes, healthcare providers not prepared for exceptional populations, and establishing self-advocacy and self-management skills for emergency situations. So we just discussed how complicated healthcare transitioning is. So now let's talk about who should be driving the transition process. Doctors, therapists, parents, or caregivers? But the reality is that to the greatest possible extent, the process needs to start with the transitioning youth. All the others are definitely needed for guidance, information, and support, but the person with the most important role in deciding how to proceed is the transitioning youth. Regular conversations with the youth about how or when they want to continue learning is essential for the process to work. So, gottransition.org recommends beginning the process of transitioning healthcare around 12 to 13 years of age. At this time, they recommend that the transitioning youth do the following: learn about your healthcare condition, medications, and allergies. Begin asking your doctors questions about your health. Find out from your doctor if they will continue to treat patients after the age of 18. I would also add that if you have not already started working on self-determination and future goals planning, deciding on whether you remain in your current city state or if you might move, or what kind of post-secondary goal you hope will affect the medical choices you make in the future. So start these discussions now. At age 14 to 15 is when more independent behaviors should start emerging. While still practicing previously discussed skills, it's important to begin expanding them. Let the youth start making the doctor appointment and other appointments. Create a script and sit with them as they practice. Create a time, maybe 10 to 15 minutes at the end of appointments, that your youth can spend alone time with the physician. Start showing your youth how to refill prescriptions online or over the phone and how to track when refills are necessary. Finally, start talking to youth about family medical history and start the process of creating a medical summary. The ages from 16 to 17 are the most intense, as these are the years with more robust decisions to be made. First and foremost, the individual and their families need to spend a lot of time discussing how much support the youth will need in making healthcare decisions. Is there a need for guardianship, support decision making, or maybe just a healthcare POA? Create the medical summary. Speak to all healthcare providers to determine the age ranges they accept for care and or talk to the individual about their options in choosing new ones. Start looking at insurance. Are the individuals receiving Medicaid, or are they covered under parents' private insurance? How does this change at 18? Begin talking to youth about deductibles, network coverages, etc. Finally, at age 18, the individual will be considered the age of majority. Depending on your previous choices, this will look different for everyone, but healthcare is not something that you can ever be finished with. So at teen, make sure you begin working regularly with your new adult to keep their medical summaries up to date, make sure they meet all their new doctors, they maintain insurance, and they create a file system for their important information. Now let's quickly discuss medical emergencies. Here is a list of things you should definitely start thinking about and start creating with your youth to start as soon as you can. These are very important resources and things to have on hand in case an emergency medical situation arises. These are various resources that you can find that are for you on our website. As we discussed, healthcare transitions is a very long and complicated process. Luckily, there are a few organizations out there that are set up to help individuals through this process. God Transitions is a website set up specifically for healthcare transitioning. It is supported by Health Resources and Services Admin and the U.S. Department of Health. On the website, you will find numerous resources and tools, online readiness assessments, and toolkits. If you have questions or need assistance, please reach out to us at Kentucky Spin at www.kyspin.com or at 800 525 7746.